November is Men's Health Awareness Month, and it is from this background that we decided to have a chat with a good doctor about men's health challenges. We want to focus on prostate cancer today. I know there are other health issues that men go through. We're looking at mental health challenges and also suicide prevention. We want to zero in on prostate cancer. I know we've all heard or we all know what about prostate cancer, but we need to find out from a clinical point of view what it all entails. Welcome, Doc.
Thank you, Bella.
Please can you introduce yourself to our viewers?
Dr. Nomsa Tsikai. I'm an oncologist, or otherwise known as a cancer specialist.
Thank you. So let's dive into it. Maybe you can tell us from a layman's point of view. We know it's prostate cancer, but what exactly is prostate cancer?
Yes, so prostate cancer is quite an important cancer for us in Zimbabwe because it's the #1 cancer that is affecting our men. It's also the #1 cancer that's causing mortality in the men. So it is an important cancer. And even looking worldwide, it is the #1 cancer for men worldwide. So it's a very, very important cancer. The unfortunate thing about prostate cancer is a lot of men are diagnosed late. So they're coming in with advanced stage 3, stage 4 cancer, which is a big, big problem because it means that we are losing our men to prostate cancer. So I'm quite excited to be part of this program to raise awareness on prostate cancer and hopefully get more men to come out and we actually get screened for prostate cancer. Prostate cancer is one of those cancers where we can actually screen for the cancer and catch it in early stages, stage 1, stage 2. So we need to actually get the message out there so men are aware that they can actually get screened for this cancer and we save our men's lives.
That's very true, Doc. What about, can we talk about the signs, the symptoms? When should one start getting worried? And also, are there age groups? Like from what age group should men start looking for these signs and symptoms?
Yeah, so prostate cancer, when we're now talking about how one can actually know that they have it, one would need to know where the prostate is actually located.
Definitely. That's for sure.
So prostate, the prostate gland, it's a gland that is located within the men. It's part of the male reproductive system. So it's one of the male reproductive organs, okay? So it is located just beneath the bladder and in front of the rectum. Yes, it's quite small. We say it's the size of a walnut, for those who know what walnuts are, but it is quite small. And located beneath the bladder, when men are passing urine, the urine comes through from the kidneys to the bladder, and there's a passageway through the prostate, through to the outside. So our symptoms then are related to our passage of urine, the men's passage of urine. So a lot of men, when the prostate gland develops cancer, we're saying here it's actually developed these lumps or growths within the prostate gland. So those lumps can block the passage of urine. So a lot of men have problems passing urine. So that is difficulty, like when you're passing urine, you feel like you have to push it out. Or for some men, they have the voiding, they pass urine, but they feel like it hasn't all come out completely, like there's still some urine remaining. And also for some men, it's frequency of urine, especially at night. So you're lying down, you're sleeping at night, and you find that maybe before you never had to wake up at night to pass urine, but nowadays you're now waking up 2, 3, 4, for some men even more than 5 times a night. Then it means that we may actually have a problem. And for some men, it means that there's actually pain when they're passing urine. They may even find that there's blood that comes out when they're passing urine. So when you see blood in the urine, you must actually get checked out because a lot of men think, oh no, I have bilharzia. Meanwhile, you have prostate cancer and you are keeping it until it's too late. For some men, when it's a little bit more advanced, and it's gone to other parts of the body. They may develop abdominal pain, especially in the lower abdomen. If it has gone to the bones, it likes to travel to the bones of the back, the lower back especially. It causes back pain. So also when we're having pain, that may be an issue. And for some, it may actually start to cause weight loss. That may be the presenting symptom that there is a problem. So to watch out for all those symptoms. It affects a lot of the elderly men. It's traditionally a cancer of the elderly. So we're looking at men from the age of 60 years going on onwards. They develop prostate cancer until men are even in their 90s. But the thing with prostate cancer is some men may have prostate cancer, but may die of other causes of death, like heart disease, strokes, just old age, not the prostate cancer. So it's one of those cancers, especially in the elderly, it may actually not need to be treated because men may die of other causes. But when it affects the younger men, it's usually aggressive, which is quite unfortunate. And we're finding that the younger men that are affected are African men. So studies that have been done, especially most of our studies have been done in the Western world, like in America, for instance, they compared Caucasian men, the white men, to Black American men. And they found that the Black men are at a higher risk of developing prostate cancer. And also, they are also likely to have it at younger ages. So from the 40s, you're looking at 45 years, we're getting prostate cancer in Black men. So that also translates to us in Africa, because a lot of the Black men, they originally came from Africa. So our African men are actually at a risk of getting prostate cancer, more likely to get prostate cancer than white men, and also at younger ages. We are seeing prostate cancer in men in their 30s. So it is quite unfortunate because, like I mentioned earlier, that it was a disease of the elderly. So a lot of young men think, oh yeah, so they don't want to think about it. But I'm just urging all men out there to say, even if you're 35, get tested for prostate cancer, because you're a Black man, you're at a higher risk. And also the unfortunate thing for Black men is that they get more aggressive disease. So when we diagnose prostate cancer in Black men, it's more likely to move at a faster rate than in Caucasian men. So like I was saying, in the elderly, that when they get prostate cancer, sometimes they actually don't have to be treated because it moves very slowly, before it actually causes problems. But in younger men, the biology is very aggressive. So it moves fast when from stage 1 through to stage 2, stage 3, stage 4 cancer, where we say the cancer it spread to other parts of the body. That process takes just a few years, which doesn't give us time. So it becomes a problem. And it's being more aggressive, it's more difficult to treat. So we want to catch it at its very, very early stage, where just removing the prostate gland may be enough to cure the men.
So I guess we want to talk about prevention. Because I know for us women, we go for cervical cancer screening. So can men also do that so that we catch this gland early?
That's you're absolutely correct. So the reason why we actually do all this advocacy, the awareness, is because there is something we can actually do for prostate cancer. We can pick it up early. So for the cancer process to happen, it takes sometimes on average 5 years to 10 years. So when it is happening like that, one does not have symptoms. But for prostate cancer, the prostate gland starts to release a chemical or substance into the blood called the PSA. That is short. You've heard about the PSA.
Yes. What's it?
Yes, we are always going on and on and on about PSA tests. That men, get your PSA tests done. So PSA stands for prostatic or prostate specific antigen. Yes, so it is something that is released by the actual prostate gland. Normally it's released and we get normal levels between 0 and 4 in men. But when there is cancer that is happening, cancer by definition is a group of fast-growing cells. So when these fast-growing cells are happening within the prostate gland, they cause that gland to release more of this PSA. So we start seeing more of it in the bloodstream. So from our levels that are normal between 0 and 4, once we start getting it above 4, then we're thinking, what is it in that prostate gland that's causing this PSA to go up? So very unfortunate, some men are presenting with PSA levels in the thousands. I've seen 10,000, 15,000.
Wow.
So you can imagine how long it would have taken for that PSA before we've even seen this man, for it to get into the thousands. So we want to catch it when it's just above 4.
Wow.
So how we do that is if the men are having regular tests. Yes. So annually, from the age of 40 years, we're recommending all our men, if you're 40 years, please make sure you've had a PSA blood test done. So it's just a simple blood test that we do. We draw blood from you and it goes to the lab and gets tested. Nowadays, we've even simpler tests, just a pinprick. Yes, so like people testing for diabetes, you know, you just prick
yourself.
Yes, you just prick yourself and we test. So immediately, within less than 2-3 minutes, you will get your result if there is a problem or not. And if we do find that you have a problem, then we do the proper blood test. And also we recommend what we call digital rectal examination.
Wow.
Digital rectal examination is a physical examination. I know it sounds fancy, like your computers, digital.
Digital, yes.
But basically digital just means we're using the digit.
Oh.
That is the finger. Yes, to examine the prostate gland. So for men, it is not uncomfortable. Please do not be scared. We take advantage of this examination because, like we mentioned, the prostate sits in front of the rectum. So what we do is we insert a finger into your rectum and we start feeling the rectal wall. So if there is a problem on the prostate gland, we feel the lumps, we feel irregularity on the prostate gland. So the digital rectal examination has saved a lot of men.
Yes.
So let us take advantage of this and not be afraid of getting this physical examination done. And I need people to also understand that having a high PSA blood result does not necessarily mean that one has cancer. There are other causes of high PSA tests. We find that a lot of men, as they get older, they have swelling or enlargement of their prostate gland, what we call BPH or benign prostatic hypertrophy. So that's just something that happens to men. So when that prostate gland gets a little bit bigger, sometimes our PSA levels also go up. So not to be too scared when one is actually told that they have a high PSA result. And also things like increased activity, like cycling for men, just to try and make sure when you go for your PSA test, you haven't had a vigorous exercise, because that may increase the PSA. And even sexual activity also, to just make sure that you've abstained for 24 to 48 hours from sexual activity, because that may also raise the PSA levels. So just to be aware of that. Mm-hmm.
Thank you very much, Doc, for that information. Mm-hmm. What about treatment? Let's talk about treatment. Like, we all heard that the cancer treatment is expensive. And I think most people shy away from seeking medical attention because of the cost. Can you care to elaborate on the treatment costs and what actually is the treatment process once one is diagnosed with cancer?
Yes, so treatment is quite important. I think we have a lot of myths around issues of cancer treatment. So that is quite an important point. But just for people to be aware, once we find that there is a problem with the PSA or a digital rectal examination, we have to give a diagnosis of prostate cancer. And how we do that is what we call a biopsy. So we refer men to our urologists. So urologists are specialists that are responsible for treatment of prostate cancer and the male reproductive system. So what they do is they take a small piece of tissue from the prostate gland. So they can do this via ultrasound guidance or through the rectum. So once that piece of tissue is taken, it's sent to the lab where they look at it, and under the microscope, they tell us whether there is cancer cells or not. And if there are cancer cells, then the patients are referred to the oncologist for further assessment. So basically what we do is we give a stage to the cancer. So by stage, we're just basically saying how far advanced is the cancer. So it's that stage of the cancer that directs our treatments. We treat differently for the different stages. So when we're talking early stages, we're meaning stage 1, stage 2. So this is prostate cancer that is still limited to the prostate gland. So just there within the pelvis. Stage 2, the same, just a little bit more of the cancer in the prostate gland, but it hasn't spread. Stage 3, we're saying the cancer has gone beyond the prostate gland to affect the nearby organs and also the nearby lymph nodes. Okay, so lymph nodes are part of our immune system. And unfortunately, when there's cancer happening within the vicinity, the immune system wants to try and kill that cancer. But unfortunately, it's not able to. The cancer cells continue to grow within the lymph glands. So that is stage 3. And then stage 4, we're saying the cancer has gone through the blood, what we call metastases or spread of cancer, through the blood to other parts of the body. So this cancer has gone maybe to the lungs, to the bones, to the liver. So, and in other instances, it may spread to the brain. So we do worry. So that is stage 4 cancer. So as you can see from stage 1, 2, 3, and 4, cancer is in different parts of the body, different categories. So when we find it in stage 1 and stage 2, it's early cancer, especially stage 1, where if we are doing our regular PSA, we're picking up more cancers in the stage 1 level, where still very small, very limited to the prostate gland. So we're able to actually do surgery. So here we're just operating to remove that prostate gland. Okay, so and that is quite, for a lot of men, that results in a cure because the cancer hasn't gone through our lymph vessels, it hasn't gone through our blood vessels to affect other parts of the body. For men that are not able to get operation done, that is surgery to remove the prostate gland, for some reason or the other, it may be due to ill health or advanced age, we offer radiotherapy. That is, it can be external beam radiotherapy, where we're using high energy X-rays to treat cancer. A lot of people are afraid of radiotherapy. They think that radiotherapy means that you're going to feel burnt or kupiswa.
Yes. We hear people saying, piswa.
Exactly.
So, yeah, it can be quite intimidating when you hear about that.
It can, exactly. So unfortunately, we don't have a word in Shona for radiotherapy. We call it kurapwa nemagetsi. Okay. So basically just means going under this radiation machine. When we switch it on, we direct the radiation beam to the area that we want to treat. So for prostate cancer, we're directing it to the pelvic area. And for other men, they also get internal radiation, what we call brachytherapy, where we put radiation seeds, size of a rice grain of rice. So these radiation seeds are inserted into the prostate gland and they directly release radiation and immediately the patient is treated. So once those seeds are in there, they stay there permanently and kill off the cancer cells. So that is for our early stages. But when we have more advanced stages, the operation is not enough because the cancer has gone through those lymph vessels affecting our nearby lymph nodes. So for patients that would have been operated, they need further treatment. So the radiation then comes in to clean up the area where the prostate gland was removed, to also clean up the area where those lymph nodes were, to reduce the risk of the cancer coming back, risk of recurrence. And in some men, we also require further treatments besides the radiation. They need what we call hormone therapy. So prostate cancer is a cancer that is sensitive to the male hormone called testosterone. Okay, so the testosterone acts like fertilizer to prostate cancer. So what we want to do to cause the cancer to shrink or to kill off the cancer, we want to remove testosterone from the man's body. We have two ways that we can do that. One is through surgery, where we actually remove the source of testosterone, which is the testicles. So we remove both testicles as treatment. That is treatment that has saved a lot of lives, okay, or prolonged patients' lives, so the patients that have advanced disease. We have patients with stage 4 cancer who've had their testicles removed that have survived more than 10 years. So men, that operation actually helps you to survive longer. The other way is medically. We use drugs that remove testosterone from the body. So we inject an implant into a man's body, so usually in the tummy. That implant sits there for about 12 weeks. So every 12 weeks, men come and we inject that implant. That is called Zoladex, that's the one we normally use, or Goserelin, that is the generic term. So that drug basically gives signal to the testicles to not release testosterone. So it also benefits a lot of men. The only issue with that injection is it can be a bit pricey, costing men between $250 to $300 every 3 months. So a lot of men benefit from the operation to remove the testicles. Mm-hmm.
So, Doc, let me just ask this question. We know, I don't know whether it's a myth, that when someone has prostate cancer, it also affects their sexual reproductive health.
That is correct.
Any truth in that?
That is correct. Yes. So what we find is the actual cancer can affect one's reproductive health, especially once it's advanced, because by virtue of where it's located, that it's blocking our reproductive passage. So prostate cancer can affect on its own before we've treated it, and also our treatments can affect. So the surgery, when we operate to remove the prostate gland, we've affected that passage, that reproductive passage. So for men, that may cause damage to the nerves that are responsible for man's potency, okay, for man's libido. Yes. So they may find if we cut those nerves, unfortunately, one may have problems with their reproductive health. They're not able to actually function properly and they need assistance. We do have drugs that we give to assist one actually function sexually. And also radiation may also do the same. It may also affect one's sexual function. So we also give treatment to help.
And another one that I've heard about as well, Doc, is some men tend to go to the traditional ways where they take these mixed herbs. Would that help, or they strictly have to stick to the doctor's recommendations?
So the herbs are a little bit of a problem that we're actually facing right now. Okay, so the issue with herbs, especially if these herbs, one is being told that the herbs treat cancer. Okay, a lot of the herbs have not actually been proven to treat cancer. The treatment that we utilize, like this hormone treatment I mentioned, or chemotherapy treatment or radiotherapy, our treatments would have gone through rigorous investigation, what we call clinical trials, randomized clinical trials, where we actually test our treatments on thousands and thousands and thousands of men worldwide. And to say, okay, once we've given this drug, how is it going to affect this man? We're able to actually say, when we give this drug, our response is going to be 80% of men are going to respond well to this drug. But unfortunately for the herbs, those tests have not been done. We're also able to know the side effects that can happen, the complications that can happen. To say when we give this drug, we actually educate our men that once we start giving you these tablets or this injection, you will start feeling like this. After a week, you'll start having hot flashes. Men have heat flashes from that hormone treatment. Your bones may weaken, so you need to strengthen your bones. Your breast may enlarge, so this is how we actually prevent the breast from enlarging. So these are side effects that we expect. So we actually know the side effects. But unfortunately, from these herbs, they're not coming with this information pack to say, once you start taking these herbs, after a week, after 2 weeks, you may have these side effects. We don't even know the dose. To say, without treatments, chemotherapy, we measure one's weight and height. So one is short, one is 50 kgs, another is 100 kgs. how do you adjust? Is it a teaspoon for one who's 50 kgs? Is it 5 teaspoons for the one who's 100 kgs?
Yes.
How do we dose the herbs? How is the patient going to respond to the treatment? Is the cancer going to go down by 50%? The cancer levels, our PSA, we actually measure. And to say after 3 months, our PSA level has gone down by 50%. So we can actually predict how our patient is going to respond. But how do we predict for the herbs? We need that information to actually say, when you take the herbs, how is your response going to be? How is your body going to react? So that's the challenge that we're facing. We're also able to say, how is the treatment going to react with our kidneys, with our liver, with whatever other treatments that the patient is having. A lot of patients are also on chronic medication for heart failure, high blood pressure, kidney disease. So how are these herbs going to affect other drugs that one is taking? All that information is not available. So, unless we have that information available, we don't recommend for patients to take herbal treatments. Unless if it's herbs for supplements, your zumbani, your moringa, where you're supplementing to get your immune system boosted, which helps patients that are living with cancer, but not herbs for treatment. Mm-hmm.
What about access to treatment? How accessible is the treatment, Doc? I guess the cost effective comes into play as well.
Yes, that is correct. Cancer treatment is expensive, generally, especially in Zimbabwe. Access, availability, costs are issues that we are facing. Yes. It is a problem, when I have a patient in front of me and I tell them, for this stage of disease, for us to treat your cancer, you need chemotherapy, which will cost them maybe $1,000 every 3 weeks. You need radiotherapy. It's a course for prostate cancer. We're looking at between 5 weeks to 7 weeks of treatment, which would cost them between $5,000 to $10,000 for that course of treatment. And the patient looks at me and says they're not on medical aid, of which I think 90% of our patients are not on medical aid. They are not working. They are retired. Where are they going to get that money from? So it is a challenge that even me as an oncologist, I'm sitting with patients and trying to find solutions to this. So we usually would get assistance from the government hospitals. Chemotherapy, a lot of patients who cannot afford to get chemotherapy in private, the government hospital is available. You will get assistance, especially men over 65. They do not pay. They get treated for free. So a lot of people, we do advocate that they do go to Paringatwa Hospital, Harare Hospital. They've got cancer departments, oncology departments. Mpilo Hospital, also you will get assisted. Radiotherapy also, I think we are getting our machines getting fixed, hopefully, at Paringatwa Hospital, Mpilo Hospital. But as of now, we only have radiotherapy in the private hospital, private center, which is quite costly for most of our patients. So because cancer treatment is expensive, we advocate for screening and early detection, because when we catch it early, we can just get away with operation on its own, just surgery to remove the prostate gland without needing the expensive treatments, the radiation, chemotherapy, hormone therapy. So that's why we're pushing the word early detection, screening. Yes.
True. I think you've covered most of the questions that I had. The treatment, the side effects, besides hair loss, is there anything else that you want to add on?
So the side effects, we get a lot of them from chemotherapy. Yes. So chemotherapy helps a lot of men with prostate cancer. Chemotherapy, we're using drugs that treat fast-growing cells. So cancer, we mentioned, it's a group of fast-growing cells. So chemotherapy, we inject them into the body, usually through a drip or as a direct injection. And for some men, it's tablets that they take. Yes. So these treatments are going to look for fast-growing cells and treating the fast-growing cells. But the thing that happens when we're treating these fast-growing cells, sometimes also our normal fast-growing cells are also affected, such as our hair follicles. We always have a activity within our hair follicles. Our hair is continuously growing, so it's also affected by chemotherapy, and we get the hair loss. So we also find we can get sores in the mouth, ulcers, because we always have activity within our mouth. We also find within our bone marrow, there's always constant activity. Our red blood cells, white blood cells, platelets are always continuously growing, regenerating. They're also affected by chemotherapy. So our white cells drop. That's why we say immune function can go down during chemotherapy. Our red blood cells also drop. Patients get anemic whilst on chemotherapy, and platelets go down. Patients are prone to bleeding when they are brushing their teeth because of the low platelets. But what we do is before every treatment, we check our bone marrow function to see if we are normal levels, and then we only treat with chemotherapy when our bone marrow is functioning well. We're also lucky to have boosters to boost the white cells, boost the red blood cells, boost our platelets if we're having any problems. So not to worry. And I always tell patients that come in and say, oh, your chemotherapy is going to affect the normal cells and the abnormal cells. What we take advantage of is when the chemotherapy kills the abnormal cells, the cancerous cells, their ability to regenerate is not so good. But our normal cells, even though they're affected, they've got a great ability to regenerate. So our normal cells grow back. The hair does grow back. The ulcers in the mouth heal. Our bone marrow recovers very well. So we take advantage of that. So do not be afraid. You will recover and you will be back to normal again after chemotherapy.
So you mentioned that before treatment, before the chemo treatment, one has to go for some blood tests.
Yes, that's correct.
So if you don't get the correct results that you need to go for chemo, even if the chemo is due, what do you do then?
Yes, so if the blood tests show that the white blood cells are low, we defer the chemotherapy. We do not give it.
Okay.
We give you a booster that goes to the bone, white cell booster that goes into the bone marrow and makes the bone marrow form new white blood cells. Yes, and then we repeat the blood count after a couple of days. And if it's now normal, then we go ahead. So we always make sure that we are safe with our chemotherapy.
Okay. Thanks very much, Doc, for all this information.
Yeah.
We recently on Sunday we celebrated International Men's Day, and I was congratulating my male counterparts, and most of them have never heard of International Men's Day. And do you have something that you want to share with our viewers, our male counterparts, why this day is important to them?
Oh, yes. Thank you. Thank you so much. So men, yes, health-seeking behaviors. Yes, we have a big problem there. A lot of our men are coming to us doctors late. And it's not just with cancer. It's most of the diseases, high blood pressure, diabetes, high cholesterol. A lot of men are also now being diagnosed with strokes because they've been moving around with high blood pressure and not having their treatment. We're looking here at even mental health issues. A lot of our men, they are not happy to go to the doctor and get diagnosed.
It's true.
Yeah, so a lot of men, please, we're advocating. I always laugh with men when I ask them, why do you not go for treatment? And they say, kuma hospitals, kuma club, evakazi. I don't want to be part of that women's club.
I know.
Yeah.
It's a challenge that we have to work with our men.
It is.
Get them to seek medical attention all the time, not even when they're sick, just to go for a medical checkup.
It is a big problem.
Yes.
They wait, and men, because they are strong and they want to think they're strong and show the world that they're strong, they handle or tolerate pain.
Yes.
They've got a very high pain threshold.
Mm.
So they will keep whatever is paining them for a long time until it's very advanced. So it is a challenge. Let's take advantage of the fact that with prostate cancer being the #1 cancer that affects men, we actually have a way of screening for it. This PSA test, the rectal examination that I mentioned, and actually get it caught early. I advocate and recommend that all men once a year, please just go and see your GP. Just tell your GP, I'm here. Just examine me, send me for blood tests, send me for scans. So we're looking here having your BP checked, having your sugar checked, having your cholesterol checked. We're also looking here, ask your GP to send you for a colonoscopy to get your bowel checked. You know, they'll put a camera into your bowel and check for colon cancer. It's one of the cancers that are occurring in men and women. So once a year, ask for your doctor to send you for a colonoscopy so that we see if there's any challenges. Ask your doctor to send you for a PSA blood test to check for this prostate cancer.
There you go. Thank you very much, Doc.
You're most welcome.
Thank you. So, guys, you heard it from the doc's mouth. Prevention is better than cure. Early detection saves lives. Like I always say, your health is your wealth. Till we meet again. Thank you very much. And thank you very much, Doctor.
Thank you so much, Bella.